You spent hundreds of thousands on fibroid surgery because you are told that if you are able to remove the fibroid, that you are going to take in highest within 2 to 3 months of going through the surgery. Then after you must have paid and gone through the surgery, you waited for 6 months, even some waited for years, still there is no pregnancy. Does it mean that the surgery failed, or is there any other thing to it? Hello everyone, my name is Lucy. Today I'll be discussing important issue that many women have passed through. Some are still going through with this particular thing we're about to talk today, which is why you are not getting pregnant even after going through the fibroid surgery. So if you know anyone that is preparing to go for this fibroid surgery, or they have gone through it and have been waiting for them to take in and carry their baby, still there is no positive result, please inform that person and share this video to that person. The person will watch the video and then know other things that can hinder that pregnancy from occurring or from happening even after the fibroid surgery. I have like 7 basic reasons why after passing through this surgery you might still not be pregnant. One of them is, what if the fibroid is not really the cause of your infertility? The reason I'm saying this is because, not that they did not see the fibroid, but there are a lot of things that can cause infertility in a woman. So if after removing the fibroid and still you are not taking it, it means that what causes your infertility might not be really the fibroid. Then secondly, after surgery, some women do have what is known as adhesion or scar tissue. As the wound is healing, they will form what is called adhesion. So if this adhesion occurs in your uterus, in your uterus or around the fallopian tube, there is 50% chances that you might not get pregnant. My number 3 reason is if you are having hormonal imbalance. If you are not ovulating as you should ovulate, you might not take in even after going through the fibroid surgery. My 4th reason is your fallopian tube, because the fallopian tube is where the sperm of your partner is going to meet your egg, fertilize it, then it will now move down to your uterus. So if one of the fallopian tubes or 2 of them are blocked, that's not how you are going to get pregnant, because that your egg is not going to be fertilized. So if the cause of the fallopian blockage is not treated, the fibroid surgery cannot work for you. Then number 6th reason is age. If you are above 35, like from 35 years down, 35, 36, 37, naturally the quality of egg you release and then the amount of egg you release declines with age. So if as you are aging, the chances of taking in reduces. I'm not saying that you cannot take it, but it reduces. So if what causes your infertility is natural cause, the surgery cannot take it away. Then what if, number 7th reason is, what if the issue is not really from you? What if it is from your partner? You will still not get pregnant even after the surgery. And again, in some occasions, this fibroid will start growing again. And if it grows and block, or it grows at the fallopian tube or the uterus, it can also cause it can also make baby, the fertilized ovum, difficult to implant in the uterus. And when the baby did not implant in the uterus, pregnancy cannot occur. So the reason I'm making this video is because I want you to know that although fibroid can be one of the steps you can take so as to take in. Removing that fibroid is one of the basic steps, but it does not necessarily mean that it answers all the questions when it comes to infertility. It's just one out of 100 of the other things that can cause infertility. Then secondly, you don't blame yourself if this happens to you after the surgery you're expecting to take it, you're not taking. Do not blame yourself, and then do not assume that that surgery wasn't successful. And again, do not allow anybody to make you feel hopeless. What I want you to do is, after that fibroid surgery, always follow up with your gynecologist so that other measures can be taken. What matters is your ability to determine the particular thing that causes that infertility and then treat it. So even if you are meant to believe that it's because of the fibroid, then after the fibroid, do not wait till 1 year or 2 years before you start seeking for solution. After the fibroid, always follow up. Go to your fertility specialist or go to your gynecologist to follow you up so that you can be able to take in when they are able to treat the cause of your infertility. These and many other reasons are why you can do fibroid surgery and still you are not able to take in. Thank you so much, and please do not fail to share this video to someone that you knew that has gone through this surgery before and still waiting for their miracle to happen. And again, to those ones that are preparing to go for the surgery, so that they will not put their 100% trust in this fibroid surgery. It's one of the steps to take to make fertility to occur, but not necessarily the all and all. Like, what I mean by all and all is does not necessarily mean that if you've done it firsthand, you are going to take it immediately. There might be some challenges along the way. Thank you so much. Follow me for more, and then see you on my next video. Bye.